I went back and I went up to Mrs. Henning. I said, Mrs. Henning, I just want you to remember that 10 years ago, this is what you did to me. She didn't deny it. She said, well, you were a buzzer, weren't you? And I said, yes. And then I told her all the things I'd learned about Mozart, Beethoven, Wagner, and everything. And she was speechless. And I said, thank you for introducing me to music. So Mr. Cohen, President Gunton, members of the Board of Trustees, fellow deans, colleagues, and students, before I begin my prepared remarks, I wish to just thank my family for their love, support, patience, and understanding during my whole career, but especially during the past 10 years. I have been warned not to overdo it tonight, and I won't. But on other occasions, I have described the pivotal and generous role that Denise has played in ensuring whatever success I've achieved, by nurturing our family with great love, remarkable insights, and personal strength. To her, my everlasting gratitude. Thank you, Denise. My older son, Jeffrey, who's here tonight. Jeff, please stand. I know it's embarrassing. A wonderful son, husband, father, and brother. He is, in addition, a very, very special person who combines intellectual prowess as a highly respected, innovative, and internationally recognized Talmudic scholar with wonderful personal characteristics. Not so great on the softball team, but he tried. Denise and I are just very proud of him. As many of you know, he is the Skirbel Professor of Talmud and Rabbinics in the Skirbel Department of Hebrew and Judaic Studies at New York University. And my younger son, Errol, who couldn't be with us tonight, has, after a very long and painful illness, shown great courage and is now successfully teaching English in the New Jersey Community College system. And all of us just love each other so much. Without them, I would not be here, and nothing I will relate to you now would have been possible or worthwhile. So let me tell you another story. Once upon a time, in a far-off land, an opportunity arose to create an ideal academic health center. Those who were involved in this project laid out the important framework which would be necessary for the three important components of the enterprise to be successful, namely the School of Medicine, its practice plan, and its health system. First, its mission of exemplary patient care was clearly paramount. For the academic health center to thrive, patients and their families needed to be treated with respect, humanism, and professionalism, as well as with up-to-date knowledge and highly developed technical skills. The organization needed to attract the sickest and most challenging patients from a wide geographic area, and then provide them with the kind of care that was not available in competing academic health centers or community hospitals. To accomplish this, it was important to develop a vibrant research program of eminent basic and clinical scientists whose mission and focus could be broadly described as translational research. That is, research whose goal would be to promote health, enhance prevention of disease, and when serious illness did occur, treat the patient with the most innovative, safe, and effective therapies. Of course, as the ideal model unfolded, it became clear that an educational component was also critically important for the success of these two missions, which I have described. Because young people, and we saw them tonight, challenged the status quo by asking difficult questions, demanding evidence for statements we would make, and enriching the environment with their diverse backgrounds and remarkable accomplishments. Although this organization I'm describing to you was becoming very attractive, it became obvious that something major was still missing. Those with experience in the development of this plan soon identified this as a great university, in which the academic health center would be embedded as an equal participant with the other schools, and whose excellence and partnership would enrich the academic health center. These would include schools of arts and sciences, schools of nursing, dental medicine, veterinary medicine, engineering and applied sciences, business, education, design, law and communications, and social policy and practice. And preferably all these entities would be in close geographic proximity on the same campus. Now that this beautiful organization was in place, it was necessary to populate it with people who would be loyal to this vision and mission. First, in theory, one would need a single leader model so that the three missions of patient care, research, and education could be seamlessly integrated. Of course, those who really understood how these organizations functioned optimally knew that this model was actually a myth, and that the operational model would best be described as a distributed leadership model, in which all of the organization leaders would work seamlessly together as an orchestra, each one with their own area of responsibility, but with porous boundaries and a constant reminder that the whole was greater than any of its parts. So in this regard, Ralph Muller was chosen as the CEO of the health system. He is a leader with a great love of university-based health systems, but whose broad knowledge of healthcare, including areas of policy, economic strategy, and execution, were unparalleled amongst his peers. He quickly assembled a team of outstanding colleagues, including Kevin Mahoney, Keith Casper, Beth Johnston, Michael Dandolf, Lee Dobkin, Gary Shive, and Virginia Rich, who together created the humane, respectful, focus on safety, and innovative patient care for this organization that I described. Two outstanding physician leaders, P.J. Brennan and William Hansen, were also part of this team, bringing special expertise in patient care to the organization. Now, the research enterprise that I mentioned, with its translational emphasis, was led by Glenn Galton. This outstanding leader was responsible for attracting great scientists, allocating space and financial resources to them, and for creating the seamless interdisciplinary research that translational research demands. High ethical standards in the contact of human subject research and research training were also under his purview. And then Gail Morrison was the obvious choice to lead the medical student education program, as you've all acknowledged. She is a charismatic, innovative leader and role model who inspires students and encourages faculty to devote enormous time and effort to stimulate these students. And we were attracted to the medical school part of the academic health center because these young people are unbeatable. Now, I'm sure it's obvious to you that these leaders do not exist in a vacuum. After all, they need to serve some constituency, and this, of course, is the faculty. There are 1,800 critically important team members who are responsible for carrying out the patient care, research, and educational missions of this academic health center that I described. And as well, they do community service, as you've heard from our students, at the highest level of excellence. They are organized for convenience into 28 discrete